I'm Dr. Pham from Miracle Dental in Las Vegas. I have a lot of questions regarding the mouth guards. People have been wearing that a lot, so maybe the neighbor, the coworker heard of that word, but they don't understand what it means. So today I will be answering a lot of those questions regarding the topic of mouth guard, so we can all understand what the mouth guard is about. What is a mouth guard? Mouth guard is a dental appliance that you will put over your teeth. It helps to absorb the impact of whether physical impact or injury, so that it can help protect your gum and your teeth and just protect you from having your teeth fractured. It also helps with snoring and with mild to moderate sleep apnea. So these are the example of a mouth guard. Okay, this is just a night guard for you to wear at night. This is just a regular retainer for people who finish with their Invisalign or braces. This is a sleep apnea appliance, and this is a beautiful sport guard. So those are some of the example of the mouth guard. Okay, what are these types, and what does each of these types help you protect your teeth? So the sport guard, needless to say, it's for you to put on when you play sport. The most physical involved sport would be football, boxing, or sometimes when you work out, you grind your teeth a lot. So this is the mouth guard, okay? What it does, it's custom made, so it hugs your teeth really well. So what we do is we give the inside of the guard a little softer cushion, and the outside is a little harder. But this is very, very convenient, and it's pretty soft. So you can put it over your teeth, and just to make you feel comfortable when you play sport and you don't feel like your mouth is being strained, so that it takes your focus away from your sport. Okay, so that's one. This is the night guard for you to wear at night. Similarly, we make it so that the inside is soft, so it hugs on your teeth. It gives your teeth the pillow cushion soft feel, so you feel comfortable, but the outside is hard. So we usually make it for the top. So at night you just wear them, and it prevents your upper teeth and your lower teeth from grinding, touching each other. That can damage your teeth. The next one is this is the retainer. It's pretty thin, it's soft. It doesn't help much in terms of grinding, but I have a few patients who have Invisalign. When they're done, they don't grind their teeth. They don't have any other issues. So or they grind their teeth, or they just clench their teeth. They don't grind side to side. They don't make a lot of contact to cause huge damages. So in rare cases, the retainer can definitely help separate your teeth or help absorb the impact as well. This is the sleep apnea slash snore guard. So why do people snore? When you sleep, your tongue and your muscles, when they relax, they fall back into the back of your throat, causing the airway to be blocked. So, and after they relax, they go back to their position. So they're moving back and forth. The front and the back position make you hear the snoring sound. So these guards are to pull your tongue forward, your jaw forward and your tongue forward. So it helps with the snoring. And there is another one that is a little stronger for sleep apnea as well, but it works similarly to this one right here. So by now you should have a general idea what a mouth guard is about, okay? There's another type that I forgot to mention. It's the splint for a TMJ. It is also very similar to this material. The key is that we want to make it at certain thickness so your joint can tolerate. It cannot be too thick nor too thin. So there will be some machine that can help determine the size and the thickness of the prosthesis, but it looks similar to this type of mouth guard. Okay, when do you wear your mouth guard most? And the answer is that you wear them mostly at night. Why do you wear them at night? Well, during the day Being that you are awake, you're conscious. So in case you grind or you clench your teeth, you have some means to remind yourself to not grind. This is a little trick. I usually have my patient put a dot on the computer, on something or somewhere that they usually go to or look at. So every time they see the dot, it's a reminder, hey, what am I doing with my teeth? If I'm grinding, let's separate my teeth. So that's just a little trick. But the bigger answer is that during the day, since you're aware, you can control yourself. But at night, since you are not aware, you don't know what you're doing, so you need help. That's where the guard are most worn at night for that same reason, okay? So the next question, so when you wear them, how can it help you with your grinding? There's a deeper answer to that. Why do some people grind their teeth and why some don't? There is a control mechanism that go from your brain to the muscles on the top and the muscles on the bottom. So when you're awake, when you're conscious, and when the control mechanism works well, the control system works as a brake. It tells your upper muscle, your lower muscle, jaw muscle not to grind, not to cause any injury, not to do too much. It needs to relax, right? At night, that control, that brake system doesn't work on some people, and it works on others, okay? Why doesn't it work? What controls it? Scientists have still trying a lot, do so many studies to differentiate which nerve, which system, which wiring there that do the job so that they can come in and treat the problem. But unfortunately, they haven't been able to find the exact mechanism, how to make the mechanism work when it wasn't working. So in the meantime, when we don't have the treatment to the root cause of it, well, we settle for these guard to help just preventing the damage from happening. So keep in mind, anything that you wear is more, I so-call a band-aid to the problem, not to treat the root cause, okay? So the benefit of wearing these guards during your sleep is that you help preventing the upper teeth and the lower teeth from contacting or from clenching or from grinding. That can cause a lot of damage. I have a lot of patients that showed up with teeth that worn almost half. So when you wear these guards, same thing. I have a patient that come in every 3-4 months with her guard having holes on them. Imagine if you didn't wear these guards, your upper and lower teeth would cause holes on each other. So that's a lot of damage on the real teeth that you can never have back. So these are really, really helpful instruments or tool to help prevent you from having a lot of damage. How effective is the snore guard? It is quite effective to help reducing the snoring. Don't expect it to completely take your snoring away. So any help is better than none, and it's not just the snore that it help reducing, but it also help with the breathing mechanism to make you breathe better. I have another video that talk about sleep apnea. Make sure you look into that just to understand the mechanism of sleep apnea, which cause you to snore. So by helping pulling your tongue and your jaw forward, it open your airway that help you breathe better, and along the way it help with the snoring too. How much help does it get you? Some help, but not as much as if you expect it to take it out completely. No, don't expect that. But I'm sure that some help is better than none, and you would appreciate the help that you get, especially people in your family, your partner, definitely really appreciate that. What's the difference between the mouth guard that we make in the office versus the one that's store-bought? Many differences. The first thing is that the one in office, we made it custom made just for you, so it fits your teeth very well. When it fits your teeth, so it serves the purpose of you wearing it way better. The store-bought one usually come in a very soft material, and you put on your teeth, you let it wait for a few minutes, and it becomes hard. So it hugs your teeth, but it doesn't hug as well. Secondly, the thickness at the dentist office, we have more control, we have more understanding of how each individual situation works. So we will give you the different thickness that works to just you and your unique case. Whereas at the store-bought, you just buy the material with your at an average thickness. So what if it doesn't work for you? What if your jaw cannot tolerate that thickness, or your jaw needs something thicker? You cannot control that. So after this, watching this video, make sure you understand the difference. Secondly, with the dentist, of course, the material we use will be stronger, will last you longer. Whereas at the store, if it works, it works. If it doesn't, nobody knows. You have to go buy another piece. So as much as this costs more at the dentist, but keep in mind, depend on your philosophy. Do you want to pay for something that works, especially to support the health concern, or you just buy something because it's cheap and you think that you don't mind buying another one if it breaks? Eventually, with time, who knows, you may have to pay as much as you would have paid at a dentist, but it may not work as well. For example, with sleep apnea, you don't know that the cause of it. When you choke, when you can't sleep, you might be very sleepy during the day, or who knows, you can't breathe at night. In some cases, it can lead to death. So if you have an instrument that can help you prevent all that severe sickness, think about how worth it is for you to consider spending a little bit more, okay? Next question, how would you be fit? Well, first of all, how do you know you're a candidate or not a candidate, or when someone needs a mouth guard? So in terms of the sport guard, you know how you feel if you are exposed to such a strong physical contact sport. I would just strongly you to go get it anyway, especially boxers or soccers or football. You really need one, so just go get one. In terms of the TMJ grinding, well, usually you will see a little wear and tear on your teeth yourself, okay? 2, you might wake up feeling sore on your muscle. Then 3, the dentist can definitely tell you when you come in for your 6-month checkup. We usually look at how wear and tear, what kind of wear and tear we see on your teeth, and we would advise you accordingly. And when we mention the teeth are worn, make sure you're having a little light bulb, asking your dentist if they don't mention, do I need a night guard? Take the proactive approach. If not, usually the dentist will actually initiate recommending it to you anyway, okay? When you are not a candidate to get a mouth guard, I think there's very rare case that we don't recommend. I was thinking about if you have gum disease, grinding your teeth hard can cause you to have gum disease. So when you have gum disease, maybe it's more of a reason that you should get a mouth guard to prevent your grinding. Anyway, so usually it's very rare that you're not a candidate unless your teeth are really loose. And if you wear a mouth guard, it makes your teeth more loose. But I cannot think of a situation that you're not a candidate. What are the risks or the downside of wearing a mouth guard? The downside is pretty obvious, it's inconvenient. So when you sleep, it's very, very weird for you to have a strange foreign object in your mouth. So it may make you feel as you can't sleep. I hope that with some practice, some adjusting to time, with time you might get yourself used to wearing it, and you will feel better. My mom, I made a sleep apnea appliance for my mom. She said she can sleep better, but around 4 or 5 o'clock, all of a sudden she found herself subconsciously just take them out because her mouth is sore. So she takes them out. So, and some of my other patients just said during the night they can't control themselves, but they found themselves just take it out, and in the morning they just see them across the room. So those are some of the risks. But at least they stay in your mouth for a period of time, whether an hour or 2 hours. Protect your teeth within that short amount of time, so it's still doing some job, something good for you. But so the downside is the discomfort. So that's the short answer to that question. But I hope that you can see that there's more pros than cons. So hopefully you will continue to work with it and get used to it with time. What are the costs to the mouth guard, and does the insurance cover it? The cost of a mouth guard, again, I just share with you a few samples, depend on each type. So it costs from a range anywhere between $200-300 to $500-600. And most insurances might not cover. There are a few that might cover. So before we start making you one, we definitely will go into a financial explanation before we start. But I hope you don't let the cost deter you from getting them if you ever need them, just because if it weren't for the night guard, you might damage your teeth, which will cost you a lot more. If not, when you lost your teeth or lost some of the tooth structure, you can never have it back. Whereas with the night guard, if it breaks, you can always have it replaced, get another one made. Now, what do you need to do to have a dentist make a mouth guard for you? So for us, it takes 2 visits. The first visit, you come in, we will take a record of your teeth. In the past, people may have to take the impression with that gooey stuff that they put the impression to your mouth and you wait for a few minutes. But nowadays, we already have the computer technology that we can just scan your teeth into an electronic file, and we send it to the lab. It takes them a week or so to make the type of mouth guard that you and the dentist discuss. And sometimes we have to measure the length, the thickness of the guard, and we write it into the prescription. And in about a week to 2 weeks max, when you come back, you will be receiving the guard, and we try to fit it in to make sure it fits well. Sometimes we might have to adjust it to make you feel comfortable, but that's it. It's really fast, convenient, quick, and there's no pain involved. So a lot of my patients are happy with that. I hope I answer some of the very good questions that you have today. And now with the knowledge, I hope you are confident to come in to speak with your dentist about mouth guard if you ever need one. And if you have any further questions, feel free to give us a call at 702-456-0056. Thank you.